Hello and welcome to this session of the COVID-19 Space Programme. My name is Ganesh Thrillingham. I'm the President of the UK Intensive Care Society and I'm an intensivist in London. I'd like to welcome you to this session and also to our specialty. If you're taking part in this and watching it, then you are a clinical colleague from a variety of professions who will be potentially coming to help us in critical care, and this is to help reorientate you. All of you will have clinical experience and skills of your own in your own fields. Some of you will have previous experience in critical care but may have been away for a while. And I think a theme, particularly of this session and all the others, is that really all you need to be able to come and work in critical care is clinical skills and understanding, and your existing insights and experience are going to be the key to this. Intensive care is a highly technical specialty with very dependent patients at the extremes of physiology. But despite all of that, it ultimately is just an extension of healthcare by other means. And the reassurance and the message really is that it's going to come down to clinical assessment around systematic management of the patient and application of our normal humanitarian approach to healthcare. And these talks, the three talks in this session, are all linked by that theme. And I'd like you to just bear that in mind as we go through them. As a brief introduction to the session as a whole, first we have Dr. Maurizio Cecconi from the Humanitas University Hospital, who's going to be talking to us about the recognition of the critically ill patient. And the context of that, we know that early recognition, early treatment is in the best interest of the patient. It improves outcomes, it decreases their length of stay, and it makes better use of resources and improves their recovery. So that early part and the decision-making around admitting to intensive care and the early management is one of the most important parts of decision-making that we can make. Professor Alexandre Demoule from Hôpital Pitié-Salpêtrière in Paris is going to be joining us to talk about bundles of care in critical care. And this is around the systematic application of standard, consistent treatment to improve outcomes. Now, we know that over the years and decades, outcomes from critical care have improved. And we can see this in multiple studies, for example, in sepsis, where we know that as well as the interventions being studied, we can see the baseline outcomes of patients improving over time. And a lot of that is due to our increasing understanding of the importance of consistently applying basic levels of care and interventions, such as those which Professor Demoule will talk about, and applying that at the bedside systematically day by day. And his talk will cover that. Equally importantly, Professor Ruth Endicott will be talking about the application of ethics, goals, aims and limits of treatments in critical care. And the context for that is that although this is a high technology specialty, we can apply a degree of aggressive or intrusive treatment to people in their best interest to try and make them better. We have to acknowledge that although we do our best to maximize comfort and dignity and do the right thing for the patient, this is an invasive set of treatments. Critical care isn't just a place of safety. It isn't just about having the right people and skills. All of those are very important, but it is a process. And just like major surgery or administering chemotherapy, in any medical intervention, we need to think about whether the cost to the patient is justified by the benefit to them in terms of their ability to survive and recover. And these are all very important interlinked topics. So with that introduction and really the reassurance that this is healthcare by other means, we'll move on to the talks themselves. We're going to start with Dr. Maurizio Cecconi from the Humanitas Research Hospital, and who's going to talk to us about recognizing the critically ill patient. Thank you, Maurizio.